When I came to the Fielding School of Public Health, I came specifically to work with Dr. Anne Remoyne and her disease surveillance projects. Through her research, I had the opportunity to work and live in the Democratic Republic of Congo, and there I was able to start my dissertation research. I did my dissertation on monkeypox disease surveillance, and as a part of my research, I worked at both the national levels collecting data and understanding how monkeypox surveillance actually occurs, but also at the local level, how the data is collected, how the data is used, and how monkeypox as a disease has changed over the past 13 years. So it's important to get this data because it helps the WHO, UNICEF, and the Ministry of Health impact policy changes. As part of my research on the local level, I oftentimes had to take many forms of transportation, from a private plane that has 8 seats to a pirogue down the Congo River, being on the back of a motorcycle for 8 hours, walking through marshes to be able to get to some of these locations. When you're in really, really rural places, there's no email to send the reports, there's no phones to call in how many cases of disease you saw. These kind of challenges help contribute to the disparity that we see at the national level data because they just don't even have the resources to be able to record the diseases, let alone transmitting the information up to the higher level. So now that I've completed my dissertation project, it's having a direct impact on how the Ministry of Health in DRC is collecting disease surveillance data for understanding the underreporting of cases. Now to actually have the data to show how they can make these changes gives a lot of power within the country. My work actually in the Congo isn't over. Now that I've graduated, I've actually continued on to be a program director based in the DRC with Dr. Anne Remoyne. And all of this was made possible by having great mentorship and then external funding that was able to support the projects that I work in and the work that I do. That's really set me up to have a lifelong career in public health, doing something that I love, that I'm passionate about, that really can have an impact for the health of the population.